A very good morning to you. Thank you for still keeping it on UBC TV. My name is Sophia Matovu and it's the Health Q&A. Now, there is a question that we need to tackle and have answered today, and the concern for every family. Are heart attacks sudden, or they give some warning signs, because at certain times people will think it just happened, but you possibly did not notice the warning signs, or what even exactly is a heart attack? Now, many people believe that this just happened. But is it really the case? Could there be some other underlying issues? What is the cause? Now, in this episode, this morning, I'm very privileged to host a medical expert, and that is none other than Dr. Emi Okello. He is a senior consultant and head of department, adult cardiology at Uganda Heart Institute. He's a honorary professor of medicine at Makerere University and the University of Cape Town. He is the co-director, Rheumatic Heart Disease Research Collaboration in Uganda, and he is a board member, Global Cardiovascular Health Program at the University of Washington. Now, I normally say I'm not the expert. I'll just sit down and interact with the experts. He is going to unveil it and break it down for us bit to bit so that we are able to save a life in one way or another. Good morning, Dr. Emi.
Good morning, Sophia.
How are you?
Good. Thanks for having me here.
Thank you, too. I know there are people out there complaining who feel like they should have had you at the Heart Institute, but we have you here.
Yes.
Now, doctor, let's start with normally the cliche questions. Heart attack might seem like new to people in terms of like they don't know what it means. What exactly is a heart attack?
Yeah, so that's an important question, and you're right that many people have this misconception about heart attack, and so there are two related concepts. There's heart attack, and then there's cardiac arrest. So I will explain to the viewers what both are about.
All right.
So a heart attack refers to changes in the body, changes in how we feel that happen due to a blockage, sudden blockage in a heart artery. So the heart is like a generator that pumps blood to the rest of the body, but the heart itself requires fuel, and the fuel it requires is blood that goes through small tubes called arteries, coronary arteries. When one of those arteries get suddenly blocked or partially blocked, then the patient will have what we call a heart attack. So you can have degrees of heart attack. You can have mild heart attack, or you can have a severe heart attack where the blood vessel is completely blocked. And it has a name, we call it a STEMI. It's an abbreviation. Basically, that's a bad event, and the body will change suddenly because the heart is changing. It may beat irregularly, the heart may stop. You've heard of people having heart attack and their heart stopping. A cardiac arrest is basically the heart stopping suddenly. When people die, the final thing that happens is that the heart has stopped. And but there are many causes. You can have changes in the minerals that work in the body, changes in the blood levels, or severe infection can all result in a cardiac arrest. But eventually, when someone is dying, they'll have a cardiac arrest. For you to be declared dead, your heart should have stopped. Yeah, that's the cardiac arrest. So a heart attack can happen suddenly. Like someone goes to work, and then a blood clot forms inside the heart artery, as I mentioned earlier. And because the heart, as I said, is a generator for the body, if the heart is not receiving enough blood, it won't function fully, normally. And what will happen then is that it either starts beating regularly, or you start feeling symptoms of heart failure, sudden shortness of breath, or you start getting tired, you can't go to the bathroom, you can't walk out of the office or of your chair, or some people actually collapse. You've heard of people collapsing or dying on their seats while traveling in an aeroplane or while on a road. All those can happen. So a heart attack, yes, can happen suddenly, but can also take time. But it's the changes that result from a heart attack that really disturb the body.
Wow. Yeah. Now that becomes scary when you talk about it can happen suddenly.
Yes.
Now, you say that there could be like a blockage, assuming it's a filter.
Yes, so if you had like a tube, and this tube is allowing blood to run, to take blood to the rest of your heart muscle, and then Over time, people develop what we call angina. Many people love saying that, oh, I have chest pain, I have angina. The typical angina means that you have this progressive buildup of dirt made of fat. Okay, so when you tell people about blood sugar and fat and all these things, so you have progressive buildup of this dirt made of fat in the blood vessel. So if the lumen was that big, over time it narrows. And now not enough blood is reaching the heart muscle. Remember, it's a generator. So over time, when you exercise yourself, if you are a person who goes to dig, when you go to dig, or if you previously was jogging and then now you go to jog, you start feeling like your chest is heavy, that's angina because your heart is complaining that not enough blood is reaching. Okay? In some people, that partial blockage can worsen. Okay? That blockage sort of ruptures, and then you have a blood clot that blocks now that blood vessel, completely blocking it. And when that happens, it can be dramatic. Some people are lucky. They can have that, and they still survive. They may just feel that, oh, I've lost energy, I don't have energy anymore, I'm not breathing well, something is not right, I'm not sleeping well. Actually, they do tell us in the literature that people who have experienced heart attack will have known a day or two, or even weeks before, you feel like something has changed, especially loss of energy, and then progressive development of breathing difficulty that you didn't have before. And again, we say that if you used to function normally, wake up in the morning, bathe, have breakfast, go to work, go to your shop if you're a business person, then suddenly that becomes a big problem, then something has happened. The pump, that generator is not working, okay? And I must tell you that we are very impressed with the turnaround in the attitude of fellow Ugandans over the last 10 years. People are more alert. When people experience this, they actually go to hospital. They come to hospital. And sometimes you check and someone is having a heart attack there and then. Yes.
So how does this heart attack occur when you say? But in most, is it fatal as well, or somebody can
if you are unlucky and it presents with a complication, as I said earlier, this tube or the blood vessel gets suddenly blocked. The way that the heart behaves following that blockage is unpredictable. In some people, the heart will beat irregularly and stop. And then you just see someone collapsing. If you are near a facility or people who can do CPR, you've heard of CPR?
Yes.
Yeah, cardiopulmonary resuscitation. Then you'd be lucky because then they'll help you until an ambulance gets by. And that's what the developed nations are doing. They have, and then machines, and people are trained in supermarkets and at workplaces, so that if you collapse suddenly, someone will start CPR until paramedics come and take you to a hospital. We are trying to do that too here in Uganda. Now we have a big emergency medicine department in the Ministry of Health, and we are having as many people as possible trained, starting with health workers and then to the general public, because that behavior of the heart is erratic. And when that happens, you should be able to help that person. So if someone collapses in office or at their shop, people should jump and make sure that they're breathing and that they're able to get back their heart beating again.
Okay. Now at the Heart Institute, what's the situation like in terms of do we see many people report through with heart conditions and you're able to tell which is which? Or do we still see the laxity where some people still would prefer using other methods to think that maybe I'm just fatigued, the body is fatigued, but they do not know it's related to the heart?
Yeah, good question. So the Heart Institute is a big place if you've been. It's a very busy place, many people, there's a lot happening. We have a big diagnostics area, which is in the outpatient department, so you have people coming with all sorts of ailments, usually heart-related. People are referred from around the country. And then you have the wards and the theaters, the advanced theaters where we carry out these procedures. So we're able to very quickly know when someone has come with a symptom. And they say that, I have breathing difficulty. Someone may not say they have chest pain, they may just say that they have breathing difficulty. Or sometimes our staff members at the triage area will just look at someone like, oh, this person doesn't look good. You can see someone who doesn't look good, that this person is not normal. They've slowed down, they're not looking good, they look really weak and they're not breathing well, and the triage area will pick them and take them to the test. We have a very simple test which has been around for about 100 years called the ECG, that graph paper test that picks a heart attack within 5 minutes. Wow. So our aim at the Heart Institute and indeed at all the major hospitals is that if someone comes with chest pain or chest discomfort, they have an ECG within 10 minutes. Sometimes patients do get lost because there's so many people, who are seeking care. But we have triage areas where people should be picked up and this test done properly and quickly, so that in most instances, once we pick such a patient, we go straight to the theater. And because we have this advanced theater which I lead, called the cath lab, and where we use X-ray cameras that are able to look through a body and through a blood vessel in the hand, over the wrist or in the groin, we're able to, just use small tubes and wires and go to the heart and unblock that artery. Yes, that can be done without cutting you or doing anything. We do this within 30 minutes. But isn't it the cost? The other thing that possibly worries people most cases is why they would kind of feel like there's always the worry of the cost implications. Yeah, because the cost issue is there because we are poor as a country, okay? But I know the government has been putting out initiatives to try and increase, the income level so that everyone can achieve this. Hopefully one day we'll have more people or afford health insurance, because the equipment I'm telling you about, when we go to that theater itself was bought at a cost of 8 billion Uganda shillings by the government of Uganda. So maintaining an equipment which costs 8 billion is not easy. So you need to have some money to keep it running. That's why government allows us to charge. But it's a highly subsidized cost, but people do pay. And then this metal scaffolds, the little pieces of metal that we put in the blocked artery to make sure it doesn't block again, it's called a stent. That stent costs about $1,500 when we buy from the manufacturer. Most of them come from America or from Germany, but the government has subsidized it. So when you do everything that someone has done, maybe they'll pay 7 million, but the actual cost is 15. But patients pay 50% because it is public, it is government owned. And the reason why people are asked to pay is to keep the service running. Others, if we don't, then we have to wait for the next financial year until government gives us some money, and then the government is going to stall. So what we tell fellow Ugandans and patients who come is that we ask you to pay this money, this subsidized money, so that this service can continue running, so that if another person, your friend or another relative comes needing this service, they'll find it running. Otherwise, we'll run it for a year and then close. Okay. Which is unfortunate, yeah. So are heart attacks something that is very common that you're seeing at the Heart Institute? Yes, the numbers are going up. If you look at our data from the Heart Institute and Mulago National Referral Hospital in general, we have data from 1990. We didn't have many cases of heart attack. But when you look from around 2010, so many cases, actually heart attacks account for 10% of death cases. That's from the Ministry of Health data. But we think that the numbers are higher than that. And the reason for that is that those factors that put us at risk of heart attack are increasing. Number one is high blood pressure. Oh, yes. We have this data done by the Ministry of Health a few years ago that shows that 1 in every 4 Ugandans has, will have high blood pressure. So when you have people in a room and you count 1, 2, 3, 4, 1, 2, 3, 4, every 4th person will have high blood pressure. High blood pressure on its own is not dangerous. The problem is, do you know that you have high blood pressure? Sure. And then if you have it, are you on treatment? And if you're on treatment, is the blood pressure actually controlled? If you can achieve that, because you may not stop yourself from having high blood pressure, maybe because your grandfather or grandmother had it and you have a little gene in you, but if you adapt your lifestyle, you exercise a bit, you eat healthy, you maintain a certain weight, avoid having a lot of salt in your food, then you'll be able to control the blood pressure, and you will be able to, have a healthy lifestyle. But if you don't, then high blood pressure becomes a problem. It puts you at risk of a heart attack, puts you at risk of heart failure. Heart failure means that the heart, which I told you is a pump, is no longer able to pump enough blood that meets the needs of the body. Or you may have kidney failure. Sophia, you and I have been talking about dialysis services, which has really improved kidney care in Uganda, and we have a great team of kidney experts now. But so many people are needing dialysis because of high blood pressure. Because number one, most people don't know that they have high blood pressure. Number two, they're not seeking care. And number three, the pressure is not well controlled. That's the same pressure which we are talking about in the heart. Now we're talking about the kidney and also stroke. If you go to the brain ward in Mulago or the ICU and you see how many patients have stroke, you'll find that 9 out of 10 of them have high blood pressure. That's what put them at risk. So just paying attention to high blood pressure will have a big impact on what happens with the heart attack as a disease, heart failure, kidney disease, and stroke. And of course, you have other diseases like diabetes and cholesterol issues, but high blood pressure by far is the most common cause of all these troubles that we have.
Okay, just throw some light a little bit into the cholesterol still, because I know it also kind of blocks the arteries, that accumulated fat. Yes,
so the blood vessel, that pipe that takes blood, which we talked about earlier, should be a smooth tube that allows blood to flow, from the heart to the rest of the body, but also to give the heart itself blood. But when you have certain problems, when you are a smoker, the inside of the blood vessel will become sticky. It won't be as smooth to allow blood to flow. That's number one. Number two, if you have diabetes and your sugar is not controlled, that high sugar contributes to making the blood sticky. It won't flow as nice as it should. And then when you have high cholesterol. So the combination of high blood pressure, maybe smoking if you smoke, high cholesterol and high sugar levels, which are not controlled, which we now call diabetes, that combination results in the inside of the blood vessel becoming rough, and then the blood itself becomes thick. That makes it very easy for the dirt we talked about to start building on the inside of a blood vessel, and over time the blood vessel gets blocked. So in a best case scenario you may have angina, but in the worst case scenario you may have a certain blockage of the blood vessel. So our messages out there usually include knowing that, first of all, knowing your blood pressure level or the status, knowing your blood sugar, knowing your kidney function, knowing your cholesterol level, because you can treat those, you can control those, you can basically control all the three or the four. And there are many people who have had high blood pressure, they've had diabetes, they've had high cholesterol, and they live a normal life for 20, 30, 40, 50 years. So it is possible to live normal life if you have those, but they need to be controlled. And the first way to control all this is to know whether you have it or not.
Okay.
Yeah.
Then are heart attacks specific for a particular age group, or it can affect anyone?
It depends on the risk factors that we are talking about. So the typical heart attack that we've been talking about due to the buildup of the dirt made of fat and other blood cells happens usually in people, in men over 40 and in women over 50. Why? Because in those age groups, they have a higher number of people with high blood pressure, they have a higher number of people with diabetes, they have a higher number of people with high cholesterol, and they may have other things. But we also have special groups. For example, if you have like pregnant women, in certain pregnant women, they may develop tears in the inside of those blood vessels as complications of pregnancy. We have had 1 or 2 women a year who come with a heart attack in pregnancy. But theirs is not because of the cholesterol and the pressure. It's because of the changes in pregnancy. Another group is people who have heart failure for some other reason, and they may have blood clots inside the heart. Those blood clots may go in those blood vessels and block them, ending in a heart attack. But by and large, the majority will be due to lifestyle diseases, including high blood pressure, diabetes, and high cholesterol. So over 40 in men and over 50 in women.
Okay. Now for okay, we have some viewers who've already started participating a lot earlier.
Okay.
Okay, this is Tumsime, and they're asking, is heart attack related to high blood pressure and stroke? How can we avoid this? How can we avoid a heart attack? Yes,
Mr. Tumsime, yeah, the central factor there is the high blood pressure. High blood pressure, as I've mentioned already, can put you at risk of a heart attack because it causes the inside of the blood vessel to become rough and the blood then becomes sticky, and so it's very easy for the dirt to start building up inside the blood vessel and put you at risk of a heart attack, and eventually, you know, the blood vessel may get blocked. Same thing happens with a stroke, that the blood vessels or the tubes that take blood to the brain that, you know, come from the heart and go through the neck to the brain can also have a buildup of this dirt, which we call plaque. Plaque is basically fat mixed with certain blood cells and certain minerals in the body that become hardened and start narrowing those blood vessels. If it happens in the brain, you know, you can start having mini strokes, and then eventually you can have a massive stroke. Something with the heart. So we actually do have terms that, you know, how we have a heart attack, you can also have a brain attack, which is a form of stroke. Yes, so the common factor there is high blood pressure, but again, diabetes or uncontrolled sugars do contribute, and high cholesterol.
Okay.
Yes.
Then hello UBC, good morning. I'm Patrick, tuning in from Zambia. I would like to ask the doctor, are there possibilities that I may be having pressure, because sometimes I have pain inside my chest, but it suddenly disappears?
Yes, you have to go and check your blood pressure. So how we define blood pressure is that, you know, we say that, and this is defined by the World Health Organization, you know, so that different countries sort of have a standard. We say that your blood pressure should be less than 140/90. We use two numbers. There's an upper number, which we call the systolic pressure, that's the 140, and the lower one is called the diastolic. Those terms come from the cycle of the heart. You know, the heart squeezes and relaxes. So when it squeezes, it generates certain pressure. That pressure is the upper one, which the machine gives you. When the heart relaxes, that's the lower pressure. And we want it to be less than 140/90 on more than one occasion. If you come the first time and your pressure is 160/90, I may not start you on treatment because maybe you're just anxious because you're meeting a cardiologist for the first time. So I'll tell you to go back and maybe check again after 1 week. Unless you come to me and you are having chest pain, or your breathing is not well, or I do a blood test and something else is not right, then I'll start you on medication because you're starting to have a complication. But if it's just chest pain that comes and goes, you need to go and see the doctor. They will likely measure your weight, measure your blood pressure, measure your blood sugar, your kidney function, and your cholesterol, and then they'll talk with you on strategies to control blood pressure, including lifestyle changes. They'll tell you need to exercise, they'll tell you need to eat vegetables. Vegetables do have potassium, which is an important mineral that the body uses. It helps to lower blood pressure, and they'll help you to reduce the sodium chloride, the white salt that we use for cooking, which is good. The body needs that salt, and I want to emphasize this. Please do not avoid salt. The body needs salt, but you should eat salt that is cooked in the food. The salt you should avoid is the one from the table, the one you add, the raw salt, from the salt shaker. Please avoid that, but do eat food which has salt. If you go off salt completely, you're going to come with another problem, which we don't want, okay? Make sure you eat food which has salt. But if you do eat vegetables, it helps because that's another form of salt that lowers pressure. And then, yeah, so you work on that, and then you want to reduce certain foods, you know, especially if you're over 40, you want to reduce what we call the carbohydrates, you know, the white foods, because they have a lot of sugar, and you want to have more vegetables, you want to have more legumes and more protein. That helps to give you more lean muscle mass. You know, you have more muscle other than fat, and that helps many people without stressing yourself so much.
Then talk about milk, because there are certain times when some of them at a particular age bracket, they tell them to limit the amount of milk they take.
So milk has several components. One, most important, milk has protein, but milk also has fat, and it has sugar. So when you have milk, you don't need to put sugar. And I struggle to tell this to my children, but also I've also seen people at work, people put so many spoonfuls of sugar in a cup of milk tea. You shouldn't, because milk already has sugar, and your body can handle that. When you put too much sugar in your milk, then you are stressing your pancreas, the organ that produces insulin, that regulates your blood sugar, and that's how people develop resistance to insulin and over time develop diabetes. Yes, so milk is good. If you can get skimmed milk, that's milk without the fat, that's the best milk to have. I have told that to someone and he said, no, that doesn't taste as good as the other one. I said, okay, the other one, yes. If you take the full cream milk, then you should exercise, because you have to balance it. Otherwise, the fat in the milk becomes, starts increasing certain fat levels in your body, and it will go up. So you need to balance that. But skimmed milk, you have the protein, and you should be okay. Even if you have diabetes, you should handle that well. The problem is the fat, because we're trying to improve the sensitivity of your body to insulin.
Then there are certain times, if they get the unskimmed milk, the full cream milk, they think that when you dilute it to a particular capacity, then possibly it's getting a bit better. You're
not able to get that ratio yourself when you dilute it yourself. I know you can if you make it really light, but then you won't be consistent. That's a problem. One day you may do it, the next day you'll be like, just give me the full thing, so you need to try and get this. If you can't get of milk, please get the skimmed milk, and then so that you have the protein, because the fat will become problematic over time. There are a few people, I've met a few people who handle full cream milk very well. They, it doesn't change, their blood sugar levels or their fat levels, but those are people who exercise a lot. So, but I wouldn't advise that for everyone. If you have cholesterol problems, if you are over 50, you don't exercise a lot, if you're having weight issues, please get skimmed milk. It will help you with the weight, but you want to cut off the fat.
Okay. Yeah. Then I am Molingo Charles from Sironko. My question is that if I eat uncooked salt also, does it cause pressure?
Yes, uncooked salt, or what we call the raw salt, that's the salt you add at the table. The people who add salt to their food before even tasting the food. There are also people who move with salt shakers in their pocket. That's a bad habit. Please drop it. That raw salt pulls water in your body. We call it expansion of the plasma volume. So there's a certain volume of blood in your body. When you take raw salt, it pulls, it brings more water to it, and it expands and starts causing pressure. It's just like when you leave a sack of salt outside, when you go the next day, you find it is all watery, because it is pulling water from the atmosphere. So raw salt does that to our bodies. That's why we say don't do raw salt. When the salt is cooked, it is dissolved, and it doesn't have the same capacity, and yet it will meet the needs of the body, in terms of the salt, because we need the salt to allow nerves to work well and the kidneys to work well, and so we need it, but the cooked salt, not the raw salt.
Okay. Yeah. Dear doctor, thank you for the show. I'm experiencing a problem where each day I feel like vomiting whenever I eat anything, be it food or tea, and it is worse when I take tea or anything sweet. This same person, this is Alex from Arua, is also asking, my mom's palm is hard and the skin around her palm or hands and fingers is hard when pressed, yet I assume it's supposed to be soft. What are the signs? Could it be related to high blood pressure?
Yeah, good questions. So let me start with the last one. So when you have thickening of the palm or of any part of the skin, it could be usually a manifestation of a problem in the body. Usually, we want to investigate how are your kidneys functioning, how is your liver, what is your blood level, you have any worm infestation, like worms, in the stomach and in the intestines. Once we exclude that, when we say, are you reacting to something? Are you reacting to a detergent, to any of the soaps, or anything you do? So it has to be systematic. So when you go to a doctor, a physician, they'll systematically go through this. If, as physicians, we have gone through all these then we'll call our other physician colleagues, the dermatologists who are expert in skin disease, and then they'll help you see that, yes. But blood sugar and high blood pressure are usually culprits, but also kidney function. Want to see that. What was the first question?
Then the first one, he was asking that he always like throws up.
Oh, yeah. Yeah, so it could mean a number of things. Sometimes when you take, in some people, when you take very sweet drinks, either in your tea or you are taking juice, yes, there are people who get nauseated. Those are just what we call the autonomic nervous system. Like there are independent nerve systems in the body that control this. And once you swallow this, there are receptors, the areas, there are points in the mouth and in the throat that sense all that. And basically, the body is telling you that this is not suitable for the body. But if it persists, maybe you have thrush caused by candida. There's candida that infects the throat. You also want to check that. The people who have thrush because they take a lot of sugar. Or they have thrush because fungal infection thrives in such environments. Or they have taken antibiotics for a very long time. When you take antibiotics for a very long time, the antibiotic kills the normal bacteria that should be in our body, and then fungus comes in, and you'll have thrush and other things. So it's good to see. But other people have acid reflux, and so again, the approach is systematic. When you go to a doctor, we systematically assess and see if it's just your body telling you that you're taking too much sugar, or you actually have a serious problem, that has to be addressed, and you need further workup and treatment.
Okay. Then hello, good morning, UBC TV. What causes low blood pressure and the management? Because you've talked to them about the high, now there's a question about the low.
Yeah, very important question. Most times in hospital we emphasize diagnosis and treatment of high blood pressure, and yet the most acute problem tends to be low blood pressure. So low blood pressure means that the upper pressure, the systolic, is less than 100 and the lower one is less than 60. Now, there are people who have normal lives. Their pressure is 100/60. They're just born like that. Okay, so you have to know your baseline. What is my baseline? What's my pressure? If your blood pressure has been 130, 140, and then suddenly the pressure starts going down, one means that those minerals we were talking about, the sodium, the potassium that usually come from salt, maybe you're having hormone issues. There's a little organ that sits on top of the kidneys called the adrenal glands that produces certain hormones. When those hormones are deranged, your blood pressure will either go up or go down. So you need a workup for that. More acutely, if you're having issues with your thyroid hormones, you may have that, or if you've had an accident and you are bleeding. If you are a young adult woman and you are not sure whether you are expecting, you are pregnant, it's good to go to hospital. There are people who have pregnancy outside the tubes, ectopic pregnancy, and because it's in the tube and the tube is narrow, that can break, and then you start leaking, like blood is leaking out of the ectopic pregnancy. So your blood pressure will be low, you'll be dizzy, you start fainting. So if you've missed your period and you are not sure, please go to hospital, because that can be tragic. If that ectopic pregnancy suddenly ruptures, initially you may have leakage. If it suddenly ruptures, it can be fatal. So all those, low blood pressure is really an urgent medical condition. It's not clearly an emergency unless the emergency is defined, but it's a condition that requires you to go to hospital. Please go and see a health worker, and then they'll see if your baseline has been low, then that's fine. But if it's a new thing, you need quick workup to look at your hormones, the minerals, and other body organs. You need a scan to look at your kidneys and that little organ that sits on top of the kidneys, and also to see your heart function. When the heart starts to fail, even people who previously had high blood pressure of 160, over time the blood pressure starts coming down because the heart now is so weak or weakened that cannot pump enough, and so the blood pressure will go down.
Okay. Yeah. Then good morning, UBC. Thank you for the information. Edwin Mubonga from Moroto. Then this one is from Bushenye calling, asking, how do I quickly detect a blood clot? Because I believe it's somehow related to the stroke. I mean to the heart attacks.
Yes. So we have two types of blood vessels or tubes in the body. we have the arteries that take blood from the heart to the rest of the body. And then we have the veins that return blood from, you know, the head and the legs back to the heart, so that the blood then, that's the blood that doesn't have oxygen because the oxygen has been used. So that blood goes through the heart and to the lungs to get oxygen to be used again. Yeah, so we have blood clots do form commonly in the veins because the veins are thin-walled, and when you sit for more than 2 hours at a time, whether you are at work or you are traveling in a car, or from here to Kabale, from here to Arua, from here to Soroti, all those places that require you to travel for more than 2 hours, there's a risk that you have a blood clot forming in your legs, what we call deep venous thrombosis. And I will return here to come and talk about blood clots. Then blood clots that form in the arteries are more acute, as we're talking about the heart attack. That is the blood clot forming in an artery, or the blood clot that forms in the arteries of the brain. So today we are talking about the blood clot in the arteries of the heart and the brain. And as I've said, it's due to you know, the inside of the blood vessel becoming rough, and then the blood becoming sticky due to high blood pressure and diabetes and cholesterol. In the vein, you don't have to have those things. As long as you sit for more than 2 hours at a time, because the veins have thin walls, you sit and compress your vein like you and I are seated now. So if you sit for more than 2 hours, you have to get up, go and drink water, go to the bathroom, so that you're not compressing the veins. If you do that, then you'll have that. So to answer your question, if you're having veins, blood clots forming in the veins of the legs, usually you start feeling aches or pain in the legs, and then they start swelling. For some people, it will be severe pain. For some people, it's dull pain. But once you start seeing swelling, basically it means that you're having a blood clot forming. And there are tests that we do. There's a blood test that we do called a D-dimer test that is done quickly, and we show whether you have a blood clot in the body. Because normally, as a normal person who has not had surgery or who has not had an accident, you should not have a blood clot in your body. But if that test comes out positive, we then go for more specific tests to look. There are scans, ultrasound scans called a Doppler scan, that goes to the veins and the arteries to see, are you having a clot right now? The blood test is showing us that you have a blood clot somewhere. Can we confirm? And then to show that the blood clot is here, and we have the treatment now. We have many treatment options for blood clots. That's in the vein. In the arteries, it's more dramatic. If it's in the heart, you come with a heart attack. If it's in the brain, you may have a mini stroke or a massive stroke due to those risk factors that we talked about.
Okay, and then, yes. Doctor, thanks for the show. I am Mercy from Paida. I usually feel breath-like sound from my chest, even with less strenuous chest exercise. Please, could there be a sign of an impending heart problem? Yes and no, Mercy. Good question. So there are several breath sounds that, you know, when the doctor pulls the stethoscope, you know, that tube that we use in hospital, and listen to your chest, there are many sounds that we are trained to pick. And there are normal breath sounds, and there's a certain way that they sound. But if you start getting, you know, musical sounds, you know, like the sound of a cat, if you've ever put your hands on your cat at home, you'll see that people who are having a foreign body, if you have a foreign body, something, maybe an insect has entered your nose and has gone to your lungs, that's more for adults. Children do push foreign bodies through their nose, groundnut or bean seed. Those can cause those musical sounds. But also people who are developing asthma, you may not have had asthma as a child, and then as an adult, if you develop asthma, then you're going to have a musical sound. Or people who cook in poorly ventilated kitchens and they inhale a lot of smoke, they later develop bronchitis and other airway conditions that happen due to the progressive blockage of the airways, which we call chronic obstructive pulmonary disease, COPD. And we have physicians who have specialized in lung diseases. Now we have the Lung Institute in Mulago, and you know, we have diagnostic tools for this. We're able to get that, including X-rays.
So Mercy, if you continue having that musical sound, you need to go for an assessment. It's likely to be a problem coming from your lungs first, but it's also possible to have a musical sound from your chest if you're having a heart attack, heart failure. But musical sound in heart failure is quite dramatic, though. It doesn't happen gradually. You'll be very sick, you're short of breath, you're wheezing, and you're really struggling for breath. The one for the lungs can happen gradually unless you're having an acute asthmatic attack.
Okay. Yeah. Then greetings, Madam. Still James from Kampala. Thanks for the program. What causes failure of blood pressure to lower even when the baseline tests have been done and echo and an ECG are all normal? Different combinations of medicine have failed to work. Then there is frustration in BP readings. In the morning it's always so high, then in the evening there is some reduction but still high, can be around 150 over 103.
Okay, so 150 over 103, as you remember we said normal blood pressure is 140 over 90 and below, so that is high blood pressure. And yeah, so majority of the blood pressure that we diagnose belong to one of two categories. So this category is called primary hypertension or essential, meaning that you cannot really pinpoint the cause. Usually you have some remote history that your relatives, your grandfather, grandmother, or your parents have had high blood pressure. So you have that in your genetics, and then as you interact, as you grow, you eat food with salt, or you eat nyama choma which has salt, all that raw salt will interact in your body and start causing your blood pressure to start going up. Okay, but you cannot pinpoint, because that's why we advocate for exercise and lifestyle change. But in a small percentage, we have about 1 in 10 people will have what we call secondary high blood pressure or secondary hypertension. In those people, it's either due to a problem with the blood vessels, the main blood vessel in the body called the aorta, it gets narrowed and you are born with that problem, or you're having problems with the kidney, or problem with the little organ that I say sits on top of the kidney, so your hormones that regulate blood pressure and blood sugar are deranged. So that second category, the secondary hypertension, we can look for a cause, find it, treat it, and actually the pressure reverses, goes back to normal. But in the majority of cases, you cannot pinpoint. So the idea is to, number one, diagnose the pressure, get you on appropriate combination of drugs, and he has said that he has had quite a number of drugs. But there are many, and more drugs are coming out, so we just need to keep trying, especially once we have excluded the secondary causes, and we're now concentrating on this primary cause, which covers the majority of the people. So we have to use a combination of drugs. Sometimes it's the timing of the drugs that you are taking. Sometimes it's a combination. There's a certain metrics that we use to get which drugs to combine with which ones. So sometimes it's just good if you've tried one or two, go back to the doctor, and the doctor can then check and see. In few instances, we have had to admit patients and inject them, give them injectable blood pressure medication that are combined with the oral ones. But we almost always succeed in getting the pressure controlled, unless your kidney function is not okay. If the kidney function is not okay, if the kidneys have failed, or if the hormones are not okay, those have to be addressed first before the pressure can go down.
Oh, wow. Yeah. Okay. Good morning, UBC. I'm Charles from Wakiso. My legs swell when I stand for long or sit for long. Is it related to blood pressure?
Yes and no. There are people whose bodies retain a lot of salt, that salt that we talked about. So you have to check your eating habits. Just make sure that you don't add salt at the table. You may not be adding, the raw salt in your food. It may be just the normal salt in your body is, that the body is retaining a lot of that salt. That salt is not getting out of your kidneys and into the urine adequately enough. And in that case, you can see a doctor, and then they'll adjust and maybe get you on certain medication that will help, and the swelling will go down. That's one. Two, high blood pressure itself, as I said, because it's causing a lot of tension in the blood vessels, both in the extremities, in our hands and our legs. Some people do have swelling of the feet as a presentation, as the first presentation of high blood pressure. But also certain high blood pressure medication, certain classes of high blood pressure medication, those drugs are very good with blood pressure control, but they do have a side effect. One of the side effects is swelling because they cause retention of water. So it may be one of those three, but also the people who have veins and those veins are not doing their work. Veins, as I mentioned earlier, are supposed to help you move blood and fluid from the rest of, from your feet back to the heart. In some people, the veins are not competent. They're not doing the work of pushing the blood up, and the veins may be failing, and sometimes we have to check and see that if someone has like varicose veins, or varicose veins where the veins are swollen, or there's venous incompetence, that the veins are not pushing the blood, and the veins themselves are the problem, not that you have pressure. So all these things can be checked, and the intervention from the doctor will depend on what was found on the investigation.
Okay.
Yeah.
Thank you for the show. I am Joyce. So, doctor, I get paralyzed in the arms and palms, and that I cannot hold anything. Sometimes in the morning, could it be high blood pressure?
No, high blood pressure doesn't usually present the first time with paralysis, although paralysis in the hand, some people present it as pins and pricks, or numbness in the hands and in the feet are really coming due to involvement of the nerves. Okay, so we have nerves. We have two types of nerves. The nerves that allow us, move our feet and body, and they allow the muscles to get electricity and move. And then the nerves that allow us to sense things, to touch, for you to feel and say this thing is hot, this thing is cold, or when I ask you to close your eyes and I touch you in a certain part of your body and you're able to feel it, those are sensory nerves. They do very, they have very interesting function, but they also get irritated very easily. So things that we eat, sometimes spices in the food. We saw a lot of people presenting with paralysis of their hands and feet and the body, especially after the COVID-19 problem, because many people took to taking spices and really hot, peppery, anything that they could come up with, and the result was that they had a lot of nerve irritation, and that had to be treated over time. So when you have that, you need to check that. But also, people who have diabetes, if your sugar is not well controlled, you can have paralysis, because diabetes does affect nerves, and high blood pressure in like a late stage, or kidney disease, but usually it may not be the first presentation. So you need to look back from simple things first. What are you eating? Are you eating a lot of spices? Do you have high blood pressure? Do you have diabetes? Do you have kidney disease? So again, we work systematically to find out what is causing this paralysis. But it is quite common, and there's treatment.
Okay, this one goes, good morning, doctor. I'm Chris from Fort Portal. I feel tired very suddenly during walking, or even when I use a panga to cut firewood, or when I even try using a hoe to dig, causing me to feel like I'm not getting enough air supply. My pressure fluctuates between 117 and 146. My glucose fluctuates between 5 and 7. What is my problem?
Good question. Yeah, your problem is that you get tired easily. We need to find out the cause of your problem. Yeah, so when you get tired easily, number one, means that your heart is not pumping sustainably. Because when you exercise, when you get your panga to cut a tree, or to, or you get an axe, or you go and jog, the body increases your blood pressure to a certain level and should be able to sustain it. In people who have high blood pressure, that level is above normal. And so the same heart that has generated your pressure is now struggling because there's a lot of resistance due to the very high blood pressure. So we want to make sure that we know what level of your pressure, the level of your blood pressure when you are cutting or doing an exercise. So there are tests that we do. There's a machine called a treadmill that will get you on and you run as if you are, the one that you see in the gym. There's a medical one that allows us to see, as you do exercise, we're able to see how your blood pressure and your heart rate increases. And we're able to see, maybe when you are at peak exercise, doing whatever exercise you do, your blood pressure reaches 200, the upper one. If it gets to 200, that's very high, and you're going to struggle. You're going to get short of breath because the heart just can't work against that resistance. So please get help. Said he's in Fort Portal.
Yes.
Yes, so we have a cardiologist who has been training with us, who is now at Fort Portal Regional Referral Hospital. So please go and see the cardiologist there. They should be able to help you do this test or send you over to us at the Heart Institute, and we're able to do this. But we'll also check you for other things, check you for diabetes, your kidney function, and also see how your blood pressure behaves over time to see what's happening.
Okay. Then, hello, doctor. I'm John from Entebbe. My son always gets pain on the left leg from down to the ankle, and sometimes gets swollen, only one leg. It is always worse when he's at school. What could be the problem? Yeah, so that's usually a focal problem. Focal meaning that it is, you know, around that area. It's not involving the rest of the body. So the question there is, how are his leg arteries? How are his leg veins? Because if they swell, if it's a vein, means that the vein is not doing its work of allowing blood to come back to the rest of the body. If it's an artery, maybe the artery is narrow so that blood that comes from the heart is not reaching the leg and the pain. So it's a simple step to do. Bring your son, and most centers around the country should be able to do that Doppler scan and see the health of the arteries and the veins to just see what's happening, and the solution is usually there. The worst case scenario, of course, is that he may have a blood clot, but if it's on and off, it's unlikely that he has a blood clot in the leg veins. It's just that the veins themselves may have a problem, or the artery, and a simple Doppler scan will be able to get the problem. Okay.
Yes.
It looks like most of the questions we're getting coming in are more related to many people asking themselves if some of the conditions they are manifesting with their blood pressure, where now, of course, we know that it can also result to affecting the heart, hence a heart attack.
Yes, commonly heart attack and kidney disease and stroke and heart failure. So the most important thing, I always tell people, when you go to a health facility or you hear that there's a medical camp in your town, in your city, just go and have your blood pressure taken. Know your numbers, know your baseline, that you know what, you may be 30, 40, 50 and you've never had your blood pressure taken. Please go and have your blood pressure taken. At least you'll know. If it's normal, the next time something happens, you'll be like, you know, the last time I took it was 120 over 80, which is the average normal. That's good. So then you'll know that now it's 150, it has gone up. If yours is 90, over 50, over 60, that means that your blood pressure at baseline is very low. If you have symptoms with that, then you need further investigations, medical investigations, for us to find out what's happening. So know your blood pressure. If you have an opportunity to know what your blood sugar is, to know what your kidney function is, and the level of your blood cholesterol. Cholesterol is good. The body needs the cholesterol to do its functions, but it has to be kept within certain ranges. Just like sugar. We all do need sugar. You've seen when your blood sugar goes too low, you start shaking like that. So it has to be kept within a range. When it's too low, it's problematic. When it's too high, it starts damaging the body. So it has to be kept within ranges. That's why you have to do this. I always tell people, if you're over 40, go and have these things done every year. Invest in that, because health is wealth. If you're a business person, if you're very busy in your office, you want to be healthy for you to be able to achieve the, you know, the goals that you've set for yourself. Because when you start falling sick, then you spend time seeing us instead of doing your business. So we tell you, you know what, get to know your baseline, do a medical at the beginning of the year, so that the rest of the year you can spend your time doing what you do best.
Okay. Yeah. I'm going to take this as the last question for this morning, because we have other business. A lot of young people are dying suddenly. 1 minute someone looks fine, and the next minute they collapse and die. It is blamed on cardiac arrest most times. How can it be avoided? Then the same person goes ahead and says, this is Sarah. Dear doctor, I feel there is a need for mass sensitization on CPR, even in schools, because it is very critical, looking at the high rate of heart attacks and cardiac arrests.
Yes, Sarah, that's an important question. We've had, as a country, we have very many cases of people dying suddenly. Most of them are young people, and the key is that most people are exercising. People are going for marathons, they're going to the gym without knowing their blood pressure. Remember I said when you exercise, your blood pressure naturally goes up. So you need to know what your baseline blood pressure is before you go to the gym, before you go for the Ginger Marathon or Kasese Marathon or the Gulu Marathon. Please know your blood pressure. If your blood pressure is high, have it treated before you start working out in that gym, before you go for aerobics, because any exercise that you do, the blood pressure goes up, which is the normal body response. But if your baseline is good, you'll be able to handle. If you're starting at 180 instead of 120, then 10 minutes into the aerobics or into the marathon, you'll be at 250 and you'll die because one of your blood vessels will just rupture. So we've had instances like that, and we are trying to make sure that that is avoided. Yes, about the CPR, yes, we have, as I said earlier, we have a whole commission in the Ministry of Health who is heading emergency medical services. Mm-hmm. You've seen the ambulances have gone up, and we are talking with them to make sure that the CPR has gone to all the hospitals, schools, so that someone should be able to save you, make sure that you're breathing, that you have a pulse, as they're calling an ambulance to come and take you to hospital. Otherwise, most times, you know, if you die, I mean, if you collapse and no one helps you, you know, make sure that you don't swallow your tongue, or your tongue doesn't go into your throat and stop you from breathing, then it just worsens the situation and people end up dying. Okay. And it's unfortunate. And we can definitely do something about that.
Okay. Yeah. Now, I'm sorry you still have so many questions flowing in. It's just that time is not on our side, and we're going to have to wrap it up from here, because you can see we have a committee on Parliament coming in shortly, right after this. But I would like to tell you one message stands very clear. The heart will always send some whispers to you.
Yes.
Pay attention to those whispers. Don't take certain things lightly. We're into the habit of going and getting off-the-counter drugs. Once you take Panadol and you feel a little bit better and energetic, and you sleep and rest well, eat well, drink well, then you're as well as thinking that you're sorted. But still, since you have still a lot of questions, still as far as the heart health is concerned, trust me, next week we shall possibly still have Dr. Emmy still come through, Okello, and this time we shall talk about blood clots and also intertwine how they're still related. So keep some of your questions to yourself. Next week we'll still be talking about heart-related conditions, and I believe Dr. Emmy will be kind enough to get off his busy schedule and come here. Please, I would like to stay heart safe. Let's join Parliament right now.
Madam Chair, the pages are there, only that at times you move from 26, you go to 27, from 30.
And he distributes new ones. So explain as we have the